The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with my co-host today, Paula Yule and Otto. Paula and I work together at the Department of Services for the Aging, where she's the Deputy Commissioner, and Otto, everyone knows, everyone loves, all-around PI, member, fabulous ambassador. So welcome, guys.
Thank you.
Welcome.
Good morning. So this morning we have on Dr. Janice Wang, who is the director of Northwell Health Adult Cystic Fibrosis Center, and she's going to discuss everything about sleep in older adults. Full disclosure, we are pre-recording this, so it's a Monday, and I'm actually feeling quite sleepy, so I'm going to take, a lot of notes from Dr. Wang in this. So thank you so much for joining us, Dr. Wang.
No, thank you for having me. It's a real pleasure to be here.
I have a question right off the bat.
Off the bat.
Let's get into it.
You're the director of the Northwell Health Adult Cystic Fibrosis Center, and the topic that we're going to talk about is sleep. Could you maybe say, how does that tie in?
Yes, of course. So there are two different subspecialties within pulmonary medicine, actually. So cystic fibrosis is a genetic lung disease, and it's a subspecialty that I specialize in. I'm also boarded and trained in sleep medicine, which is a different subspecialty. So I practice both general pulmonary cystic fibrosis care and, of course, sleep medicine.
So cystic fibrosis is something that you inherit. It's genetic. So I'm assuming that means that if you were fortunate enough not to get whatever gene that is, you will not get cystic fibrosis.
Correct. You would need to inherit a mutation from one of each parent. So some people are carriers of cystic fibrosis, and some have the actual disease because they have mutations inherited from both parents.
Does it do anybody any good to be tested for that particular gene early, and would that help make the problem less?
Yeah, absolutely. So actually each state, particularly New York State, is very good about newborn screening testing. So when babies are born, they're right off the bat tested for it and screened for cystic fibrosis. But we are coming to find that a lot of diagnoses are being made in adulthood because our knowledge and library of mutations is growing, and it really depends on patients' symptoms. So we get a lot of referrals from other subspecialties like infectious disease doctors, ear, nose, and throat doctors, because the symptoms are primarily respiratory infections, sinus disease, breathing complaints, and also gastrointestinal, like bowel issues. So those are the main symptoms of cystic fibrosis. And if there's ever a suspicion, their primary care doctor or their other provider would think about genetically testing them and send them our way so we can further assess for cystic fibrosis.
Wow.
Not apparently, there's no cure for it, but you would work with them in minimizing the effect of the symptoms.
Yeah, right. So yes, so right now, it's a rare genetic disorder. So across the country, there's about 33,000 people with cystic fibrosis. And there's no cure yet, but there are very good medicines to combat the so-called protein defect that results from the genetic mutation. So it's kind of addressing the consequence of it, but it doesn't address the genetics of it. So that that treatment itself actually is eligible for about 90% of the patient population. So we still have some work to do for the remaining 10% of people living with cystic fibrosis. So there are a lot of new clinical trials going on, focusing on genetic-based therapies right now.
Well, I'm sure there's just always progress, like so many of these things, from where we once were. So hopefully it'll continue
Oh,
in that
yes,
direction. So,
yes. Because the life expectancy is dramatically improving. We're not there yet. It used to be the life expectancy used to be in the 30s not too long ago, like in the 1990s, early 2000s,
oh, wow.
and now it's in the 50s. So
Yeah.
people are living better
Yeah.
quality of life. They're living longer, healthier, staying out of the hospital. But it's still very challenging to manage, especially from the patient perspective.
I would think also you mentioned the word rare. I mean, a real fact of life in the world is the more rare it is, the less effort is put into it, frankly, just
Mhm.
because of finances, in my judgment. Um, people aren't going to make as much money out of curing that as they would something else. It's sad to say, but it's true, I think.
Yeah, well, we got to remain hopeful, and things are, at least, progressing in the right direction. But I'm going to veer off back into our sleep topic. I know Otto needed that burning question off of his
Well,
brain.
no, I was
Um,
just curious because, you being the director of that uh, adult cystic
yeah,
fibrosis,
right. What does it mean?
I was just curious I can imagine if you have that problem, sleep is an issue. Uh, and, and then sleep, of course, can be an issue beyond cystic fibrosis
Uh-huh.
um, for a
Certainly.
lot of people. So that's where we're at, right?
Yes. So let's go. Basically, obviously, our listening sleep, everyone, as Otto said, can certainly relate to this topic, but our main population is the aging population. So, how does, I was thinking, as you get older, how does sleep and aging kind of, how is it affected? What are the changes?
So it shouldn't change too much. I think what ends up happening is as we get older, our habits change, our daily routines may change. As we reach certain milestones, like retiring, we have more time on our hands. So I do see a lot of people who are older and they're not working anymore. They have all this time on their hands, and they pick up new habits. So they're perhaps watching more TV. They have the luxury to nap whenever they want. So sometimes that ends up influencing their sleep schedule. So just to give you an example, napping actually everyone has a sleep debt that we accumulate over time. And if we pay into that sleep debt, we get less sleepy by our expected bedtime. So when we're working or we have obligations, day-to-day obligations, and we don't nap, our sleep debt builds up and builds up. And actually, it's in our favor to have sleep debt by the time we're ready for bed so that we don't have insomnia. We don't lie in bed awake, tossing and turning, and it kind of helps to strengthen our sleep drive so we have a nice consolidated sleep until we need to wake up the following morning. So as people have changes in their day-to-day routines and napping, for instance, or doing activities towards later evening, environmental things like bright light, a lot of electronic devices, or even hobbies like watching TV, or even like something that's day to day, like cleaning in your house. Like those are very alerting activities, and they can actually they can precipitate insomnia. But I would say so those are some things that we can see in people as they get older, but there are also some myths, so to speak, because
Right.
people, as we get older, they should still try to achieve 7 to 9 hours of sleep. It really shouldn't change as we get older. But I think with insomnia, that plays a big role. A lot of people assume that they shouldn't be expecting good sleep, good quality sleep, or a nice stretch of 7 to 9 hours. So they feel like, well, this is my expectation of getting 4 to 5, and that's that. But I would say I would strongly encourage people who have that change in their sleep schedule and their quality of sleep, or their quantity of sleep, should really get it looked at with a sleep specialist.
Yeah, that's, and that's what, so with the sleep, so is there kind of a rule of thumb if you're noticing a pattern, I'm sure we've all been there, we've been tired, one day, like, when do you know, like, I should probably contact a sleep specialist?
Sure. So, like if you wake up feeling unrefreshed, you should always have some level of feeling more refreshed, energetic. Um, if you are drowsy during the daytime, usually if it depends. So like what I usually do is I ask patients that I see, are you dozing off when you're active or inactive? So inactive being like sitting on the couch watching TV or being a passenger in a car, versus something that's more alerting and active, like being the driver in that car, or actually being in a room, eating lunch and with your family or friends and falling asleep at the table. So those are inactive versus active, to kind of give an idea of, well, it's definitely more likely to be drowsy when you're inactive. And it can be normal if you're just sitting on a comfortable couch and watching TV. But being a driver and needing to stop and pull over, that's dangerous, obviously. And that is something like an active activity that you really shouldn't be drowsy performing.
I have a little bit of that inactive drowsiness. I'm call myself a professional napper. Uh, and I always had that ability, even going back when I was a kid. But I think that, and this is my own 2 cents worth here, I think that when I was a kid, I was diagnosed with being somewhat anemic, and I'm still somewhat anemic. And I do believe, to the point where they really don't do anything about it, but I do believe it contributes to me having the ability to nap, because it's just the way it is. That's who I am. But I have no problem sleeping at night either. Uh,
Yeah.
That's great. You're lucky,
my
Otto.
point, I guess my question is, are there legitimate reasons why you might nap and it's really not detrimental?
Yeah, so like the symptoms that I was describing, like they would really need to impact your day-to-day functioning. Like if it's interfering with what you need to do, like the naps, then that's problematic for you, and that should be looked into. But if it doesn't interfere with your sleep or what you need to do throughout the day, then it's perfectly fine to nap.
Yeah, I mean, I'm definitely in the inactive mode. If I'm active, I'm not. I don't nap or get tired. Uh, but if I sit down and it's a nice, comfortable chair, as you described it, like a nice recliner, and you make the mistake of putting your feet up, then
That's
you're
it.
done.
Yep,
I'm with
I
you,
know the
Otto.
feeling.
I think we've all been there.
Yeah, I have a quick question, Dr. Wang. I guess I was wrong, but I thought as we got older, we somehow needed less sleep. So that sounds like I'm completely wrong there. Like you really should be able to get your like 7 to 9 hours. Aging does not make a difference there.
Right.
Okay.
Yeah.
Yeah.
Everyone still has their circadian rhythm, the sleep drive they need to accumulate. Certainly some people just throughout their whole lives say that with a total sleep time of 5 to 6, I'm perfectly fine, and
Yeah.
I don't need more than that. And that's everyone's own, their own circadian rhythm and the amount of sleep that they need. So that could be normal for them, but it really should match what you've been getting since adulthood. Like certainly, like as throughout childhood, um, there's need for longer sleep periods, and then it kind of plateaus out into young adulthood, where that should be where you land.
Thank you.
What about like somebody, and this doesn't happen all the time, but you get a dream, something weird, uh, like me, and I've had it where I used to travel a lot in business, and occasionally I'll get this thing where I'm in some city somewhere. I have no idea what city, and I'm with a few people, and I'm looking for my car because I'm in this strange city. And it feels like this dream could go on for a couple of hours, but I'm sure it really isn't a couple of hours. How about the dreaming thing in terms of sleep? Is there any knowledge about that, or is it just kind of that's the way it is?
Yeah, so dreams are such an interesting phenomenon. You know, I hope one day with technology advancing, we
Right.
could measure dreams, but unfortunately, we don't right now. What we do know is that dreams tend to happen in REM sleep, which is dream state sleep. And that's when we lose muscle tone in our bodies, except for like our diaphragm, our rectal muscles. And that by evolution is protective because we don't want to start acting out our dreams, which ends up being a sleep movement disorder called parasomnia, where people actually act out their dreams and can get hurt. But dreams tend to happen in REM, and that happens in 90-minute increments, and they get stronger towards the later half, the second half of your sleep, like towards early the following morning. And but what's interesting is if someone's really sleep deprived and they normally sleep 8 hours and they couldn't get 8 hours, and for a stretch of several days they've only slept like 5 or 6. Well, once they are able to sleep, they will have what we call REM rebound. So in the early part of the first half of that night, when they really sleep, they're going to have really strong dreams right off the bat, and it could feel very realistic, and it could be very deep because you're in deep REM sleep. And these are all things that we actually could measure on EEG recordings in the sleep lab. And unless they cause issues like you acting them out, they're not harmful.
Well, on that note, we have to take a break. After the break, we will continue talking with Dr. Janice Wang, who is the director at the Northwell Health Adult Cystic Fibrosis Center, all about sleep in older adults. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-hosts, Otto Loos and Paula Ewell. We're going to jump right back in with Dr. Janice Wang, who is the director of the Northwell Health Adult Cystic Fibrosis Center, all about sleep in older adults. So prior to the break, we were talking about, dream, because, sleep is just such a fascinating thing in general, and especially the dream world. Out, I'm with you, because there are times that I feel that I've had a dream and I feel exhausted after the dream. And it's probably because you're not sleeping fully, is what's tied into it. But I do think that that's something that has often impacted it myself as well. But there's so many. I mean, in doing research for this, you, Dr. Wang, did a wonderful presentation at our advisory committee meeting
Thank
in
you.
February. And I know that there's so many different sleep disorders. So I'd love to kind of give everyone an overview because I think there's a lot of people out there who are just unaware that they might have something.
Sure. So, I mean, one of the most common sleep disorders that we see is called obstructive sleep apnea. And that's where we have, if someone has obstructive sleep apnea, they have pauses in their breathing when they sleep. And what happens is their airway collapses, and they could be sleeping throughout this event, this episodic event, and not wake up. But what not be conscious of it, but their brainwave activity, their body is trying to wake themselves up. So if you think about like trying to breathe against a closed windpipe,
Oh,
you're going to
gosh.
work harder and harder, and your brain's going to go bounce between deep sleep to light sleep, and then your quality of sleep is no longer good, and you could wake up feeling very unrefreshed and have excessive daytime drowsiness throughout the day. So that's one of the many things that we screen patients for, that primary care doctors, cardiologists, ear, nose, and throat doctors, bariatric surgeons, you name it. They're all making sure that that type of phenomenon is addressed, because long-term untreated sleep apnea carries a great risk: cardiovascular, diabetes, stroke risk, arrhythmias, when it's very moderate and severe in range. And some people, I always want to stress, if they have certain risk factors like significant weight gain, or sometimes it's just the anatomy. Some people with a thin body build, they could still have sleep apnea because they have a jaw that's different. It could be pushing the tongue further back, and the tongue itself could be large and blocking the airway. So all these types of things between anatomy and body habitus play a role. And some people don't feel it at all. So it's important to really investigate further with a sleep study objectively, because I've seen people with severe sleep apnea. They stop breathing.
Yeah, I've witnessed it and it's
Yeah,
scary.
yeah.
I've had family members and all of a sudden you're like, oh my, it's so alarming.
yeah. I see a lot of patients whose spouses are the reasons they're in the
Right, right,
clinic.
right.
Yeah.
Yeah, because I guess, like they're the ones kind of witnessing it. If it's happening
Witnessing
to
it,
you, you probably
hearing
don't
the
know. Yeah.
snoring. Yeah.
Right.
Could things like a deviated septum, nasal drips, stuffy nose, allergies and whatnot, could they all contribute to sleep apnea?
Yes, they certainly can, because it's one system, it's one like plumbing, so to speak. So your airway, your respiratory tracts, starts from you breathing in your nose, behind your throat, and down to your trachea and your lungs. So it can definitely play a role. Sometimes people tend to have nasal congestion seasonally. Hopefully that's just um, a, a temporary symptom and it's relieved, but some people have to go and get sinus surgery
Yeah.
to relieve their obstruction. It's not a quick fix, I would say. Like sometimes it's not an entirely a curative procedure for sleep apnea, because it involves deeper down in the airway, not just the sinuses.
What about like this thing right here? Um, you know, like I look at it every day and it's
Otto, I want everyone to know if you're listening on the radio, he's pointing to his
oh, I'm
watch.
pointing to
Well,
my Fitbit,
Your Fitbit.
yes.
electronic or smartwatch or whatever term you want to use. It tells me, usually it tells me I had a good night's sleep, even if I don't feel like I did. It says 86 and good. Um, Does that mean anything to somebody like you as a doctor?
Yeah, I think it does. So a lot of these fancy devices that some of them I've seen, like people wear rings as well that
Right.
measure
Yeah, I've seen that.
it's linked to an app on their phone and it measures your oxygenation.
Mhm.
The technology is getting pretty good. They're not like medical grade equipment devices, but they're still pretty decent that it could be a good screening tool to alert someone if they have a concern. With the oxygenation, I would say we definitely want to confirm with our equipment. And the Otto, the watch you were describing, it senses motion. So it's pretty much sensing if you're tossing and turning or moving your arm or anything like that. And it's basically assuming that you're awake during it. And if you're not moving, it's sensing that, and it's just taking a ratio of how much time you've spent not moving around versus moving around. And that's we have a similar device. It's called actigraphy, and that's basically assuming that you're asleep when you're not moving, um, and that you are when it records that you're not moving. I might have said that in the reverse.
Well, with
I think I said that in the reverse. But yeah, so like if it records that if it records movement, it's assuming you're awake.
what, we're not selling anything on this show, but, and I'll ask the question, uh, do you have experience where some devices are more accurate than others?
There's there's limited studies. I definitely some of the newer generation of like the Fitbit, I believe, was studied in the literature and showed some good correlation with their technology and the movement that it records, and even the other ones. I don't recall the actual brand name, but the oxygenation.
Yeah, I think, it's like Dr. Ray goes back what you said, like the fact is there's so many other factors that could like, impact these things because they're not medical grade. But I do think with these things, they probably are, just a good kind of screening tool or supplement. So if something happens, you might not have known that. And then now you can go get it kind of checked out. So it's kind of like a good like first line of defense,
Yeah.
a lot of times.
Good
Exactly.
to have a
Yeah.
baseline, right? You can find your
Right.
own baseline too, I
Yeah.
think. Like my cardiologist asked me about, devices that I wear and some of the data that it tracks. And he asked to keep an eye on it and let him know if X
Right.
or Y. And I gave him all my numbers. It was great. And so I know now, like, you watch it. So,
Yeah.
normally that's not something I would ever think to do, but now I do. So it's helpful to have some of the data and what my
Yeah.
my baseline is. So that's
We're
helpful.
now starting to get heavy deep into the allergy season,
Yeah.
which
Oh,
Mm.
I wrestle with. Um,
Yeah.
and you end up taking medication or antihistamines or whatever. Does that impact sleep? Like, is it a balancing act here?
Yeah. So I would say definitely if you have nasal congestion and post nasal drip and coughing as a result of like the seasonal allergies, it can definitely disrupt your sleep. And what I generally recommend is people take nasal sprays, whether it's saline to keep their nares, their sinuses open and patent. Some people resort to nasal fluticasone, which is a steroid in the spray that you can also um, give one in each nostril to relieve any congestion and reduce that postnasal drip, that runny nose that happens during spring allergy season. Some people do take antihistamines. I definitely would say avoid Benadryl. It makes
Mm.
people
drowsy.
drowsy. It's extremely, it has a lot of side effects. not just drowsiness, but it can cause urinary retention if people have trouble urinating from things like enlarged prostate. It can cause confusion, brain fog, imbalance. So I would avoid Benadryl. And if you need to take an antihistamine, do the non-sedating ones. I mean, some of the commercial names out there like Allegra, Zyrtec, Claritin. And conservatively, you could just try to also sleep on with your head propped up more.
Yeah. It makes such a difference. Something as simple as that really does go a long way.
Yeah, because it reduces the inflammation, the congestion is very gravity dependent. So a nice trick is, say like you have congestion, you can't breathe through one side of your nose. So if you sleep on that side, so say your right side is blocked, it's congested, and you can only breathe through your left. So if you sleep on your right side, where the side of the congestion, by gravity, it's just going to stay congested and keep the left side open. Versus if your right side is congested and you sleep on your left, then you're just congesting both sides.
Okay.
So it's good to sleep on the side that's congested and prop your head up with like 2 pillows, and just use a lot of like symptom control.
That's an interesting thing, because without really thinking about it, one side of my nose, when I roll over to one side, I can never go to sleep because the good one is
You're
being
passing it
blocked,
back and forth.
and
Yeah.
the bad one is blocked. So now I'm laying there thinking, well,
See, well,
this will
Otto, now
clear
you got
up.
the golden nugget. You got Dr. Wang gave us a golden nugget of sleep on the side of congestion. I'm going to totally take that with me.
Right.
We always laugh, Dr. Wang, that we have these golden nuggets in every show, and that's one that I'm going to go home and tell my husband about. Yes.
Okay,
Sleep on the bad side.
Sleep on the bed side.
That's interesting.
So
Is
now
he
we had mentioned about sleep apnea, and so if you is that something that you could go away, or is there always certain treatments? How is that kind of treated?
So if the underlying cause is weight related, with significant weight loss, it can be cured. If it's anatomy related, like the way your jaw is positioned or your palate, things like that, it may be a little bit more difficult. And sometimes, the treatments are generally devices, because obstructive sleep apnea, if you think about it, is a blockage. So we currently don't have medicines to unblock it, except wearing devices like a dental appliance or a CPAP machine that you wear a mask either over your nose, under your nose, or over your nose and mouth, and it's connected to a small device that blows positive pressure of air and kind of like stents open your collapsed airway, kind of like reinflating that tract to keep it nice and open so it doesn't close off and your oxygen doesn't drop and your heart rate doesn't raise and all these types of things, and you have a nice sound sleep. So it's usually been devices, and people always ask, and I completely understand, is this a lifelong thing? Like, do I have to wear a CPAP or a dental appliance for the rest of my life? And it really comes down to the underlying contributing factor, weight versus anatomy. A lot of people, if it's related to weight, weight gain, there's a new drug that's a weight loss drug that is the first FDA approved drug that was approved late last year for weight loss and for sleep apnea. It's a diabetes medication. It's an injectable, and that is extreme. Being the first medication for sleep apnea is extremely exciting, and people are getting cured of their sleep apnea with it if it's successful and they respond to that drug.
What about I'm sorry, but
No, it's okay. Go ahead.
no, talking or snoring in your sleep, are they signs of sleep apnea? And actually, nobody does either one of those. That's what everybody thinks. But another person thinks you talk in your sleep and thinks you snore in your sleep. Uh, but I don't.
Of course not.
I'm perfect.
Yeah. Are
So
they signs of sleep apnea?
they definitely could be. So what you're describing, like the any type of movement, including sleep talking in your sleep, is abnormal. And that's called a parasomnia. And the first thing to really make sure and evaluate for is if it's sleep apnea related. Parasomnias happen when there's a disturbance in your sleep. It could be as simple as noise, like someone like knocking on your door, and then you could start sleep talking or moving around. Um, I had a patient once whose cat was apparent. Basically, we found out that the cat was like licking their owner, and it was inducing the parasomnias, the abnormal movement. And when it comes to sleep apnea, well, a pause in your breathing is one of the biggest components and disturbances in sleep, and that can trigger abnormal movement. So by addressing environmental or sleep apnea related disturbances, it can really alleviate that movement, whether it's sleep talking, or some people it's just kind of it could be what we call bruxism, just like jaw grinding your teeth, and that could be in itself a type of abnormal movement that you could look for disturbances, or like just kind of thrashing around a lot, not from a restless insomnia related thrashing, but just like moving around your extremities, your legs, and
Well,
your
on
arms.
that note, we have to take a quick break. We will continue talking with Dr. Janice Wang, who is the director at Northwell Health Adult Cystic Fibrosis Center, all about sleep in older adults. You're listening to Project Independence in You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-hosts, Paula Yule and Otto Los. We're jumping right back in with Dr. Janice Wang, who is from the Northwell Health Adult Cystic Fibrosis Center, and we're talking about all things sleep. A lot of our personal questions, too. I know Otto has a list of things he just needs some comforting. He wants to know about snoring. You know, we won't question you, Otto, about all these things. But we had mentioned, and you always hear about this circadian rhythm. If you could just give us another little like look into what is circadian rhythm, and just kind of how to different habits that you might be able to enhance this.
Yeah, so that's circadian rhythm is our internal clock where when we're ready to be drowsy and fall asleep versus when we're ready to wake up. So a lot of things that can affect your circadian rhythm could be caffeine intake. Coffee, for instance, can have a half-life of up to 6 hours, meaning it takes that long just for your body to metabolize half of that concentration of caffeine in 6 hours. So it would need even more time to completely be eliminated in your body. So trying to avoid caffeine past 12 o'clock noon would be good to help
Paula, we better write that one down. I see Paula's face like,
We're in trouble.
Well, people who drink a lot of coffee, maybe their caffeine tolerance has picked up a little bit, so maybe it's not.
There you go.
so
Dr.
much-
Wang's trying to make us feel better, Paula.
Yes,
So
thank you.
just don't totally panic.
I have a weird habit. I'll make coffee around 10 in the morning, and at 4 in the afternoon, I'm drinking that same cup of coffee. So that's
Oh.
probably not a good, that's a habit I should probably work on.
It must be
You're
right by then.
you're a sipper. That's
Yes,
me.
yes, just drink it.
A cup
Yes.
of tea lasts me 5 hours.
Yes.
So caffeine, alcohol intake, we had mentioned earlier, but like bright light, noise, napping, certainly medications that people take that can make them drowsy or more alert, that can all affect their circadian rhythm. And over time, your sleep schedule could start shifting and work against your circadian rhythm too. Sometimes even social obligations, like people who are night owls versus early birds, it's hard to be where they need to be sometimes because their natural tendency is how they would normally sleep on a day off, on a long stretch of a vacation or things like that.
Yeah. Does the temperature make a difference in your sleep, your quality of sleep?
Yeah, absolutely. So it's nice to be in a cooler and easier to fall asleep in a cooler environment. Cooler, darker, noise-free.
Like anything that goes wrong with people, there are thousands of marketeers out there selling something that's going to fix the problem. And many of them don't work, but people still buy them because they think it's going to fix their problem. I did read your notes about a lot of the different medications that don't really work. What really does work?
So yeah, we have to be careful when we come across all these medications, especially if they're not like FDA approved, and different manufacturers are making them. Like certain a lot of the medications that are marketed for sleep aids, a lot of them tend to be like just relaxants to help promote sleep and not necessarily have sedating effects. So things like kava tea, chamomile, valerian root, electrolyte supplementation. I would just, strongly suggest you run it by your primary care doctor if you're interested. Like magnesium can also be sleep promoting. Melatonin's a big one. So just going back into the circadian rhythm, we have a lot of hormones that are driven by our circadian rhythm that go by the time, our internal clock. And melatonin is one of them that tends to pick up. Our brain releases melatonin to promote sleep towards the later evening. So some people may try over-the-counter melatonin. I would say try 5 milligrams at most. A lot of bottles are, a lot of companies are selling 10, 20 excessive amounts, milligram dosages. I would say like 1, 2, or 5 milligrams are more than enough to help promote sleep. And it really helps to draw sleep forward and increase that sleep drive.
Good stuff.
I tried melatonin for the first time this past weekend. And it actually, what I bought, it was 10 milligrams. So that's probably too high, but it actually really did help. I was really pleasantly surprised. You kind of expect, let's try this, but, so we'll see, but it's not something you would want to take every day, right? It's something that's more occasional use, or what's your advice?
Melatonin's one of the few medications that the studies have shown no harm in long-term use.
Okay,
so
good.
But I would say like just definitely reserve to when needed.
Yeah.
You mentioned magnesium.
Something like that, Doctor.
I'm sorry.
Yeah, with something like that, Dr. Wang, like Is there a certain time frame? Because I know a bunch of my friends, you take that before bed, and I've heard them say like, oh, if I don't take it like at a certain time, then I'm like zonk the next morning, or is that just in their head, or is that kind of how it works? Like before bed, you should take it up to a certain amount of hours before or something.
Yeah, it depends on the medication. Like some prescription drugs, um, it's recommended to take it
Hmm.
within half hour because they're really strong. So just be
Right.
ready for bed within half hour. Some not so intense medications, you have up to 1 to 2 hours to take it. And it also depends on your sensitivity. Um,
Right. That's a
some
great point.
people with just the same exact medication they take before bedtime, they have morning grogginess versus other people, the same dose, same exact medication, don't have that morning grogginess. So I always strongly recommend if at any point that you'd want to try a sleeping aid, just make sure you don't need to get up early, you don't need to drive
Mhm.
anywhere, that you have that opportunity to sleep off the grogginess.
You
Yeah, no, that's
mentioned
definitely.
magnesium before, and I know
Yeah.
people who've taken magnesium for leg cramps, and they say
Mm.
it helps. Um, I guess my question is, people do have problems getting leg cramps at night. What is the cause of that, and what can you do to minimize the fact that you do get leg cramps?
Yeah, so leg cramps, we have to really differentiate, just try to figure out if the cramping is related to um, a sensation that we describe as restless leg syndrome, where people have they could describe a creepy, crawly, crampy feeling, and the only thing that relieves it is moving their legs or getting up and pacing around. Um, and generally that we make sure that the person isn't iron deficient. If they are, iron supplementation would improve it, that they're not anemic. um, Other versions of leg cramps are just you're electrolyte deficient and things like magnesium, so you can get blood tested to check for that and see if just supplementing that electrolyte will improve the cramping. I would also just want to make sure if it's related to a neuropathy, like if you have diabetes, which can also affect your electrolytes, it can cause muscle aches and cramping.
Mm. Yeah, no, because I always, that's saying, my husband a lot of times will like say, my leg, it's just I can't, I just can't like fall asleep. And now I'm gonna bring this home, Jen, too. But and I know that there's a bunch of other habits too, and I remember you saying too that, you know, the exercising, before bed is certainly not something. So is there like a kind of a window for that, or how does that impact?
Um, I would say probably like avoid exercise 4 to 6 hours before bedtime. It's very stimulating, and um, you want to kind of wind down and relax and de-stress. Some people use relaxation music, meditation, reading. A book, as long as it's not too exciting. Some people really get into their novel and then it keeps them up and they're reading the whole thing the whole night. So just trying to like relax and de-stress and get into that routine of this
Sometimes
bedtime. Yeah.
watching television
I
uh,
was gonna
and
say.
relaxing and de-stressing, all of a sudden your eyes are closed and you don't know who killed who. And when the show is over,
Right.
you don't know who the murderer was.
That's right.
Well,
Start it back up.
yeah, I do want to bring up just it's definitely part of sleep hygiene is to not do these activities lying in bed, because
Mm.
you just want to limit lying in bed to sleeping activities and not like being on your phone or having the TV on or any like eating, snacking, things like that, because that's a risk factor for insomnia. And I know some people who've done it for years, and it's definitely a really challenge to kick that habit. But the first thing is just remove remove yourself from that environment and only go to bed when you're ready to fall asleep. And don't
Now
lie in
that's
bed.
something.
Yeah, don't lie in bed for more than half an hour
Oh, really?
So
to try to
Yeah,
basically,
because
fall
if
that
you,
I remember, Dr. Wang, when you actually presented this, and I was so that was something that really, really stuck with me because it was just something that was so, it made so much sense, but and I actually went home and I told my mom about that too. And Mom, I was like, you have to, make sure that you don't, your body, the bed is just for sleeping, not for, all these other things. And it made so much sense.
What if you're in a chair?
Huh?
I
I know. Well, that's
always
what I
think,
think. You have to like you could be in the, the living room and then go to the bed when you're ready to. And that was another thing because I know and I because my mom has a lot of difficulty sleeping. And I was saying to her, about that. I remember, with the 30-minute window, because it's, I feel like so many of us are just, for a long time could be sitting there tossing and turning and trying to fall asleep. And, I remember you saying that, Dr. Wang, you're better off just like getting out of the bed, and then doing something that actually makes you feel tired and then, go back in. And those are, I think, just absolutely helpful little nuggets. So we got to try these things, right, Otto?
well,
yeah.
well, once in a while we talked about interruption of sleep, and you get this great idea while you're sleeping, uh, and now you can't get the great idea out of your head, so you churn it over and over again. And frankly, what I've learned, I used to use a thing where you pull the pen out, a little light would go on, and you could write what this brainstorm was. So, but now, frankly, I know you shouldn't, but I will wake up and send myself an email with this brainstorm, and then I can go back to sleep. But otherwise, I'm afraid I'm going to forget this brainstorm, and I'll lay there and mull it over and over so I don't forget it.
Does that help you fall back asleep once you
Yes,
write it
or
down?
yeah, completely. Once it's off my head, out of my head, I'm okay. But it's just, a golden nugget. If you have,
Yeah, I get it.
I think it's
Certainly
normal
makes sense.
to get ideas while you're sleeping. Maybe not. Is that normal?
That's definitely
So,
normal. I'm guilty of it. Like I have a checklist of things I need to do, and I'm like,
hmm
I don't know why, but things pop up while I'm like lying in bed trying to fall asleep, and like, oh gosh, I just realized I forgot this, and I have to write it down because
Right.
I won't remember it the next day. And like you, Otto, when I write it down, then it's like off my chest, and I can relax now now and go to sleep.
Yeah, well, it probably goes into, when you're like in bed, you're not being as stimulated with so many different things, as you are walking around. Because I mean, it happens. I'm guilty of it too. The minute I lie down, it's like, I close my eyes and then it's like a 10,000 like checklist of all these things. Like, oh my God, I totally forgot to do this. And, so it's definitely, I think because you're not having as much stimulus going on that all of a sudden all these things that you now remember when you're trying to go to bed, come to light.
Yeah, exactly.
Unfortunately, I think that there are uh, people who have pain and physical conditions that make it even more difficult than we're so far just describing stuff that a lot of people have. But I also know of people who have physical problems and pain from
Yeah.
arthritis or whatever. How do you wrestle with that one? How do you get a good night's sleep when you
It's
have these
hard.
kinds of conditions?
Yeah, it's really hard because if that's the it's always best to like discuss with your doctor like how to address the underlying cause of your pain that's affecting your sleep, or some people, for others it might be the underlying um, anxiety that's affecting their sleep, or a medication that's affecting their sleep. So by addressing each of these individually, it could help improve your quality of sleep. Like some people have musculoskeletal pain, and
Yeah.
if you address that and you manage the pain, then their sleep will improve.
And I think, as you mentioned throughout the interview, it's so important to, if you're suspecting anything, to really just check with your primary doctor and then get, if you're referred to a sleep study or a specialist, because, we're obviously all so different and there's so many things that could affect us and our sleep and for so many different reasons. So I do think, it's certainly important to go talk to your primary doctor first about, kind of what you're experiencing.
Another area that comes up is, and I've had family members go to sleep centers for testing and describing the process, which doesn't sound like a lot of fun. That's one area. And tied in with that is there's also some kind of home sleep tests that can be performed. The whole testing thing.
Yeah, so it's not always necessary to have to go into a sleep lab where you're covered with a lot of equipment from head to toe, literally head to toe, EEG and leads on your legs, all to measure all different types of disturbances. So the home sleep test is extremely minimal. You wear like a nasal cannula under your nose, and it's not delivering any oxygen or anything. It's going to measure your breathing. And you're going to be wearing 2 fabric belts over your chest and your abdomen to measure your chest rise, your abdominal rise, also pretty much your breathing effort. And then an oxygen detector on your finger, like with a little wristlet. And it's set to a recording device that's kind of pre-planned. So once it'll start recording whatever time it's set at, and then you go to sleep as best as you can. I myself have had a sleep study, a home sleep
I'm
test.
so sorry, Dr. Wang, because unfortunately we're out of time.
Okay.
So everyone's gonna have to call through or contact Dr. Wang, certainly, and we can get you in contact with her. I'd like to thank you so much, Dr. Janice Wang, for joining us and giving us so much wonderful information all about sleep studies and sleep health and all this. And I hope everyone that listened can sleep a little better now. Thank you so much, Dr. Wang.
Thank you for having me.
We also would like to thank everyone today who has joined us. You're listening to Project Independence and You on LIU Public Radio.